who will be speaking on electroretinographic changes before and after IV chemo for retinoblastoma.
Okay, yeah, first of all, sorry for the delay. Good morning, one and all. Good morning to the judges. So my free paper is titled Electroretinographic Changes in the Inner and Outer Retinal Layers Before and After IVC for Retinoblastoma. So just to give an overview, as we all know, retinoblastoma is the most common intraocular tumor in children less than 5 years of age. The current treatment options, what we currently use is systemic intravenous chemotherapy, which is the first line of treatment in India, whereas in Western countries it is IAC and intravitreal chemotherapy as an adjunct treatment. The electroretinography changes, especially after intraarterial and intravitreal chemotherapy, have been established, but there are reports, kind of very scarce report following systemic intravenous chemotherapy. Does the retinal toxicity is related to systemic intravenous chemotherapy? Does it have any effect on the retina, especially on the macular function test is limited. So with that understanding, we went ahead and looked at the inner as well as the outer retinal function using a full field ERG before and after intravenous chemotherapy in children with retinoblastoma. So this was a prospective observational study which was conducted at LV Prasad Eye Institute with the inclusion criteria for all the children who were diagnosed with retinoblastoma. Exclusion criteria, as you can see, mentioned, and the data was all the patients have undergone fundus photography using a RET cam as well as a handheld LKC pediatric ERG machine. So this is the protocol what we use in our institute. We children who have either unilateral or bilateral retinoblastoma, they are started with intravenous chemotherapy as a first line of treatment with 3 chemotherapeutic agents. For every 3 to 4 weeks, 6 cycles are completed. The ERG testing was usually done in all the children under anesthesia with a RET AIOS system, which is a handheld LKC pediatric ERG machine, both pre and post chemotherapy, and different protocols which were ISO standards, both photopeak, flicker, as well as in PHNR was evaluated at each and every visit following pre and post chemotherapy. So just to give a brief understanding about what all ERG measurements, what we quantitatively measured in our study, this was related to implicit time as well as the amplitude, which was measured both at the A as well as B wave. Coming to results, in total of 6 children, 12 eyes were included in our study. 4 children had unilateral RB, 2 had bilateral RB. 1 eye was excluded, but the other eye was included because the other eye was normal, whereas the primary eye had to undergo enucleation. The mean age at presentation was 3 years, with 1 eye in group B, 3 having group C, and 4 having group D staging of retinoblastoma. 7 eyes had a macular involvement of a tumor. I think that is very important because we understand these patients might have a poor visual acuity both pre and post chemotherapy. In terms of ERG findings, or you can say the tumor regression was observed in all the 7 eyes. That was 100% response following 6 cycles of chemotherapy. In terms of ERG changes, both light adapted single flash ERG, you can see it was shortened in 4 eyes but was delayed in 2 eyes, whereas B wave again it was delayed in 5 eyes, which is close to around 2/3 of eyes. In terms of amplitude, both A and B wave were decreased in 5 and 6 eyes respectively. PHNR, this is a very important finding what we could see. This is a specific macular function test which is usually seen in this handheld ERG machines, and this was decreased in 6 eyes, close to around kind of 86 to 90% of patients. So this is a representative image where you could see in one of the patient, a pre-chemotherapy, you could see the ERG is showing totally flat. This is the no response in both the A as well as B wave, whereas post 6 cycles of chemotherapy, you could see there was a tumor regression that was type 3, and on the ERG also you can see both the improvement in the A as well as B wave as well as your PHNR. So this suggests that despite the chemotherapy, there was not a major influence on the retinal toxicity. However, in the other patient, you could see the pre-ERG findings, you could see there was a shortened A as well as B wave, whereas post say 6 cycles of chemotherapy, despite the tumor showed regress, but the location of the tumor in the macular location, you could see there was a reduction in both the A wave amplitude as well as the B wave amplitude in both the pre and post chemotherapies. So to key findings, what we could understand from our study, the ERG in the normal contralateral eyes remain normal, so that kind of gives a clue that the systemic chemotherapy doesn't affect the normal other eye of a retinoblastoma child. There was no statistical difference between study and normal eyes in the ERG measures at follow-up. Visual acuity, I think this is very important because these are all pre-verbal children. We could measure the visual acuity. So ERG can be a surrogate marker to measure the visual acuity in these children. And despite the macular location, I think one child only had a central fixation, whereas 2 children had a very poor fixation. And the contralateral normal eyes, visual acuity remained normal in 20 to 30 in that age group. coming to discussion, more than 50% of eyes showed delayed photopic flash and flicker response after chemotherapy despite tumor regression. There was improvement in only in one eye, indicating poor recovery of retinal ganglion cells and amacrine cells, which is determined by the PHNR function. And IVC chemotherapy has no detrimental effect on the normal contralateral eyes. To conclude, I would say intravenous chemotherapy effects on retinal function are complex and influenced by the tumor location and associated findings retinal attachment. And the future research, what we recommend is to have longitudinal studies to comprehensively not only measure the retinal function at the macula, but also the peripheral retinal function, because as we all know, chemotherapy affects the overall retinal function. Thank you for your patience.
Thank you, Dr. Vishal. Do you think this is a replacement for examination under anesthesia for the follow-up? This examination?
No, so again, all this ERG is what we have to. So because this was a prospective study, we wanted to just look at the retinal function, how the chemotherapy, what we are giving systemically, does it affects the overall retinal function. And overall retinal function base we can understand, but I think the location of the tumor, I think that was one of the confounding factor, because if it is in macular location, we understand it is going to show the reduced response as compared to your pre-chemotherapy. But again, the contralateral eye didn't show any kind of abnormality in the ERG response. I think that kind of gives a clue that the systemic chemotoxicity may have a side effect in the body, but in the eye or the normal contralateral eye doesn't show any kind of abnormal retinal function test.
Yeah.
Thank you very much.
I think long-term follow-up ERG can also tell you about the duration that it takes for the retinal function to recover post-chemotherapy or post-regression of the tumor. I think that can be an important thing.
Ideally, we would want to look at every 3 weeks and look at how it is affecting the overall retinal function, might be at 1 month or 3 months, 6 months down the line. And that's where you assess the visual acuity also improvement in these children. So I think we have to have a kind of comparison between an ERG findings as well as your visual acuity, how the child is improving.
But it's a good pilot study.